welcome back. My name's Jess, and I'm here with the Avalon Foundation. I'm here once again with my great friend, Megan. She is with Choptank Community Health. And Megan, tell me how it's going. Are things starting to maybe get better? We talked about being maybe close to the top of the roller coaster. Have you felt yourself going down at all?
I think we're coming down a little bit, but it's all relative because the numbers, especially on the shore, are still way more than what we've been used to, kind of coming into the holidays. So compared to, a week or two, better, but there is still COVID everywhere in our community.
No, I think that's something that resonates with me when I start seeing case rates. And I'm like, oh, there were only 50 cases today or something. And I was like, oh my God, I remember when I used to freak out when there were 12. Like
Yep.
50 is not still okay. So let's talk about boosters. I feel like there has been some really promising news about getting a booster shot, which is when you have your third shot of most of these mRNA stuff, or a second shot of Johnson & Johnson. Is that correct?
Right. And we are getting tons of data about how much more effective the boosters are at decreasing severe disease, decreasing hospitalizations, decreasing death. It's very, very significant. So if you just got one shot and decided to not get the second shot, if you had those mRNAs, or if you didn't go back and get your booster after 5 months with the mRNA, the Moderna, Pfizer, then you're just not as protected. And that risk for severe disease is still there, where, you could end up going to the hospital.
And anybody who is over 12 is eligible for boosters. Is that correct? If it has been at least, is it 5 months since their last shot, whatever it was, right?
Yep, it's 5 months. And then for anybody that got Johnson & Johnson 18 and up, if it's been 2 months, then, you really should be thinking about getting another one. And with that one, you can get an mRNA one, a Moderna, Pfizer, to just kind of help better cover.
And tell me about if you have found yourself with a case of COVID in between getting your first round of shots. I've heard from some of those people that they feel like they don't need to get a booster because they caught Delta, for example. Would you encourage them still to go and get a booster just to protect against that have disease?
Absolutely. And, I hate to say it, but we definitely know of people that had Delta even pretty recently and have gotten Omicron.
It feels like bad luck. Bad luck.
So, and so that's, just more and more of a reason. Don't count on that infection that you had last year or the year prior. Really as the variants change, you need to kind of have as much of an immune response as possible by making sure you are up to date and you are boosted.
The data seems to back it up. I can speak from my own personal experience, not directly with COVID, but people that I know. It seems like the booster is really protecting people, and that people who have had the booster are a lot less sick. And certainly that's what the news is pointing to now. Megan, as always, it is so great. Thank you for taking care of our community. Thank you to Choptank Community Health for being such great partners. We look forward to seeing you for our very last episode on Thursday, where we're going to kind of go through the top 5 things I think that Megan wants us to remember and know about COVID. In the meantime, keep your masks on and your hands washed and all those other good things. Right, Megan? Anything else? Go get boosted if you haven't.
Yep. Sounds good.
Absolutely. See you guys on Thursday.
Thank you.